Hello students, I am Dr. C. Bharath, Associate Professor, Department of Public Health Dentistry, Vinayak Mission Sankaracharya Dental College, Salem. I am going to present a lecture topic on research methodology. These are my contents. I will be explaining about introduction, what are the principles of research methodology, what are the different types of data, about sampling techniques, that is your probability and non-probability sampling techniques, presentation of data, uses and conclusion. Coming to introduction, statistics is the term which means the science of collecting, presenting, analyzing and interpreting the sets of data, whereas biostatistics is nothing but the application of this same statistical procedures to solve the various health problems that are present in the community. So, the basic principles of biostatistics are collection of data, presentation of data, summarization of data, analysis of data and interpretation of data. In collection of data, we will be discussing about what are the methods of collection of data. Presentation of data, once the data is collected, we will be presenting the data into a logical manner so that the participants can understand. Summarization is nothing but you have to summarize the results at the end of your study. After that, you have to analyze the data that is obtained from the participants, and the last step will be to interpret the data. So, interpretation is very important in order to achieve a good result from your study. So, we will see that in detail. Before going to the next step, we will see what is a data. Data are nothing but there are a set of information that is collected from the participants. So, there are different types of data, that is a quantitative data, a qualitative data, primary data and a secondary data. So, what is a quantitative data? Quantitative data are those which can be quantified. Quantified means it can be given as numbers, example height, weight, etc., which can be given a number value to it. Okay. So, a qualitative data is nothing but those data which cannot be quantified, that is we cannot give numbers to the values or the data. Example beauty, gender, etc. So, you cannot quantify the particular data. So, that is why it is known as a qualitative data. Next, we will see what is a primary data. Primary data is nothing but the data that is collected for the very first time from the participants directly through any questionnaires, through interviews or through other methods, is known as a primary data. Whereas, a secondary data is nothing but any information that is already available. So, we collect the information from the participants from the data that is already available, like the previous health records of the hospital. You check the previous health records and collect the information, or from the other studies, whatever is available, the previous literature, you select the data. So, that is known as secondary data. So, the secondary data is nothing but any data that is already available previously is known as secondary data, whereas a primary data is nothing but any data that is presented for the very first time or collected for the very first time from the participants directly is known as a primary data. Okay. Now, we will see there are different ways of collecting the data. We cannot go for collection of information from all the participants, from the whole population that is available. That is why we select a sample of it. So, next step is sampling. So, the sampling procedure is nothing but we collect the information from the participants by taking a sample of it. Okay. So, we will see what is a sample. Before that, we will see what are the basic definitions that are necessary for knowing what is a sampling procedure. First, we will see a target population. Target population is the group of individuals to whom the investigator wants the conclusion of his study to apply. That is, what is the population that he wants to achieve, or which population he wants to check the information or collect the information from the participants, that is known as a target population. Whereas, a sampling unit is nothing but each member in the population is known as a sampling unit, that is every individual member in the population is known as a sampling unit. Okay. So, sampling is the process by which obtaining information about an entire population by examining only a part of it, that is you collecting only a part of the population. Sampling frame consists of list of items from which the sample is to be drawn. So, you list out the items that are available and you collect the information, that is known as a sampling frame. Okay. So, the main purpose of the sampling procedure is nothing but when the whole population is there, we cannot go and see all the individuals or all the participants who are present in the particular place or a particular village. or a particular community. So, we select a sample out of it, that is we select a representative sample, that is from the whole population we select a few participants from this whole population, mainly to generalize the study results. So, you can extrapolate the findings of your study to the whole population directly. So, that is the importance of this sampling. So, in the sampling procedure there are different types of study population, target population that are present. Okay. So, when you see the whole population, your target population will be your dental students. So, then target population means the population where your study you are going to implement the study, or which population you are going to see, that is known as a target population. Okay. The study population will be your final year dental students. So, your target population is your whole dental students, whereas your study population, that is you are limiting the study to only to a few participants or few participants in a particular class. So, I have selected a study population as the final year dental students, because I have narrowed down to a normal to a very smaller population. So, in final year dental students, suppose 100 students are there, we cannot go and see all the 100 students. So, again I select a sample out of the 100 students. So, that means I am selecting only one batch of dental students, that is I am selecting only 10 participants from the whole batch. So, that means I am selecting a sample out of it. So, I have selected a sample in this. So, what are the advantages of this sampling procedure? Sampling procedures usually save time and money to check the physical impossibility of items in a population, to attain adequacy of sampling results, and sampling remains the only way when the population contains infinitely many members in the population. When the population is huge, you cannot go and see all the individuals. So, you collect a sample out of it. So, that is the advantage of this sampling. Later, after the study is completed, you can extrapolate the findings of your study to the whole population. Okay. So, that means this sample should be a representative sample. So, whenever you go for a sampling procedure, you have to see whether it is a representative of the whole population or not. Only when if it is a representative sample, your study results will be valid. So, there are different types of sampling procedures. So, the first one is probability sampling and non-probability sampling. So, under probability sampling, you have simple random, cluster sampling, systematic sampling, stratified random sampling. Whereas, under non-probability sampling, you have convenience sampling, consecutive sampling, quota sampling, purposive sampling or judgmental sampling, and snowball sampling. First, we will see what is a probability sampling technique. Probability sampling techniques are again divided into simple random, systematic random, stratified random, cluster sampling, multi-stage and multi-phase sampling. So, we will see this in detail. Whereas, non-probability sampling are nothing but quota sampling, snowball sampling and convenience sampling. So, first we will see what is probability sampling techniques. Under probability sampling techniques, the first technique is a simple random sampling. It is applicable when the population is small, homogeneous and when it is readily available. The principle is that each and every member in the population has an equal chance of being selected in the study. Okay. So, that is a simple random sampling. There are different types of simple random sampling methods that are used, that is your lottery method and table of random numbers. By lottery method is nothing but you give chits and select the participants randomly. Whereas, lottery method table of random numbers are nothing but you have a table wherein you select the participants from the numbers in each table, like this. You have a numbers or number that are given for each table. So, you select the numbers randomly, that is table of random numbers. The next is systematic random sampling. As the name suggests, it is a systematic procedure of selecting the population. So, what is a systematic random sampling? Systematic random sampling is used in those cases where the complete list of population from which the sample is drawn is available, and most often are applied to field studies where the population is large, scattered and homogeneous. So, in a systematic random sampling, we select every member in the population in a systematic manner, or in a systematic way we select the population and collect the information from the participants. Okay. So, it is systematic method of selecting a sample. So, first we have to define what is the sample size and the total population. So, we divide the total population the total population is often divided by the sample size that is desired. So, when the total population is about 300 and the sample size desired is about 100, then you divide 300 by 100, you give a value of 3. So, after getting the value of 3, we select every third person in a systematic manner, that is every third individual in the population is selected. So, first person is selected randomly, after that every third person is selected till we achieve a sample size of about 100. Okay. So, that is a systematic random sampling. So, we select every third person in the population, that is in a systematic manner. So, that is why it is known as a systematic random sampling. So, there are some merits of this systematic random sampling. It is more simple and convenient to adopt. Time and labor involved in the collection of sample is relatively small. It often gives accurate results if the population is sufficiently large, homogeneous, and each unit is numbered. Okay. So, next is stratified random sampling. Stratified random sampling is used when the population is not homogeneous. Is not homogeneous means when the population is stratified, or when the population has different group of population involved like male or female. So, that is a stratified population or a stratified sample, where we select the participants by means of a strata, or a sample is drawn from each strata at random in proportion to its size. So, that is a stratified random sampling. Stratified random sampling is mainly used for selection of the population based on gender, whether you select males or you select only females. So, that is why it is known as a stratified random sampling. By means of stratification, we select the population. So, mainly adopted if the condition under study is known due to various factors like age, gender, area of residence or occupation, etc. So, the merits of this is proportional representative sample for each strata is secured. It gives greater accuracy for your study. That is why you select a stratified random sampling. When the sample is not homogeneous, then you can go for this stratified random sampling. Next is cluster random sampling. When the population is heterogeneous, vast, when the population is more and scattered over a wide area, then you can go for a cluster random sampling. Cluster random sampling is nothing but, a cluster is nothing but a group of individuals. Group of individuals, they form a cluster. So, the first stage of sampling, a sample of areas is chosen. In the second stage, a sample of respondents within those areas are often selected, and a sample of such clusters is then selected, and all units in the selected clusters are selected. So, that is a cluster random sampling. So, we call it as a cluster because it is a group of population. So, we select based on the clusters. Next is multi-stage sampling. Multi-stage, as the name suggests, it is a multi-stage sampling procedure, or at multiple stages we select the sample. Okay. So, it is carried out in several stages using a simple random sampling technique. So, multi-stage means at different stages, like first a state is selected, then a particular district is selected, then a taluk is selected. That taluk means a particular block is selected in the district, and then in that particular block or taluk a village is selected. That becomes a 3 stages of sampling. So, first stage is you select the states, then the district is selected, followed by a taluk, and then the village is selected. So, that becomes a 3 stages. That is a multi-stage sampling technique. At different stages you select the population. That is why it is known as a multi-stage sampling technique. Till now we saw about what is multi-stage. Next we will go for multi-phase sampling. As the name suggests, it is multi-phase, or at multiple phases of population, or multiple phases we select the population. Okay. So, it is part of information is collected from the whole sample and part of it from the subsample. So, number of the subsamples often decrease in the second, third and fourth phases and become smaller and smaller once you proceed to the study. Okay. So, the advantages are less costly and more powerful, and it is less laborious when compared to other types of sampling procedures. Example, for any TB patients, if any TB for tuberculosis infected patients, we check in a TB survey, we often check for empty tuberculosis cases in all in the first phase, and then in the second phase a chest X-ray is done. That becomes a second phase, and in the third phase a sputum examination is done. So, that becomes a third phase of sampling. So, that is you carried out the particular sampling at different phases, that is why it is known as a multi-phase sampling. So, in the first phase you select the population, and then perform a chest X-ray in the second phase. In the third phase you conduct sputum examination. So, that means you go for different phases, that is why it is known as a multi-phase sampling procedure. Okay, till now we saw about what is probability sampling. Now we will see what is non-probability sampling techniques. What are the non-probability sampling techniques? Non-probability sampling techniques, it is mainly divided into three types, that is quota sampling, sample of convenience, and snowball sampling. So, what is a quota sampling? Quota sampling is nothing but we give a quota. Quota means we give numbers to it. I am going to select 100 participants. So, I am giving a quota. So, that means I am giving a predetermined value or number to it, that is why it is known as a quota sampling. Sample of convenience. Sample of convenience means we give a we often select a sample based on the convenience of the participants, or based on our convenience, the investigator's convenience, we select the sample. Whoever is available at the particular day, at the day of data collection, how many individuals are there, I am going to select. So, that means I am going to do a convenience sampling procedure. At my convenience I am going to select the population, that is why it is known as a convenience sampling. Next is snowball sampling. Snowball sampling is now often referred to as referral or snowball sampling. So, the number of participants in a snowball sampling will often keep increasing. It often starts with the first person, and the numbers will keep increasing till you achieve the particular number of sample. Okay. So, often it starts with the first person, the number will keep on increasing, that is why it is known as a snowball sampling, mainly done for tobacco related surveys or tobacco related studies. So, we do a snowball sampling where the person will refer the person to the next person. So, that is why it is known as a snowball sampling. So, initial member will be there. After that, whoever is contacted to the initial member, they will inform. So, again the sample will increase. That is a snowball effect. Okay. Till now we saw about what is sampling. Sampling, we saw about what is first, we saw about what is data, what are different types of data, what are the advantages of this data. Then we saw about what is sampling, what are the different types of sampling, what are the different types, it is your probability and non-probability sampling techniques. Under probability sampling techniques, you have simple random, stratified random, cluster random sampling, then we have multi-stage and multi-phase sampling. Then we saw about what is non-probability sampling. Under non-probability sampling, we have a quota sampling, convenience sampling, and snowball sampling. Okay. Now we will see what is presentation of data. Once the data is collected, the information has to be presented in a logical manner for better understanding of the participants. So, that is why we go for a presentation of data. Okay. The data can be presented as tables, diagrams, or graphical manner. So, these are the different three criteria, the three methods of presentation of data, that is your tables, diagrams, and graphs. So, tables are usually a general purpose table and simple table. Usually these tables are more logical, the participants will be able to understand the results in a better way. That is why you go for your tabular presentation of data. Diagrammatic representation of data is usually a one diagrammatic representation, that is simple bar diagram, multiple bar diagram, and component bar diagram. Two dimensional diagrams, that is a pie diagram, and you have pictograms. So, what is a simple table? Simple table is nothing but example distribution of various subjects according to the year of study. So, this is a simple table wherein the number of students in each class is described here. So, that means it is a simple table. Master table, when many variables are added to it, then it becomes a master table, mainly used for comparison of age, gender, smoking status, physical activity, blood glucose levels, serum cholesterol levels. All these are when it is added in a single table, it becomes a master table, mainly used for comparison, or when the number of variables are more, you can go for a master table. Next is frequency distribution table. Frequency distribution table are often reserved mainly for frequencies, or when you have a range of values, that is 5 to age group of individuals, that is 5 to 9 years, 10 to 14 years, 15 to 19 years. When there is a range of values in it, then you can go for a frequency distribution table. So, this is a frequency distribution table. When you have a range of numbers or range of individuals, age group of individuals, then you can go for a frequency distribution table. So, the criteria must be followed are: the table should be numbered, title must be given to each table, must be self explanatory. So, any table that is given to the participants, it has to be self explanatory. There should be a proper title that should be mentioned, then table number should be mentioned, the heading should be there, that is for the rows and columns should be clear and concise. Data must be presented according to size or importance and chronological or alphabetical order. If percentages or averages are to be compared, then they should be placed as close as possible, and no table should be too large. When the table size is more or too large, the participants will not be able to understand the results properly. So, all these criteria must be followed in order to present a good table. Okay. So, diagrammatic representation of data, you have simple bar charts. Simple bar charts, this is a chart showing the distribution of study subjects year wise. So, this is a simple bar chart. The same table we saw about what is a simple table. The same table can be represented as diagrammatic representation, that is a simple bar chart. This is some example of multiple bar chart. Multiple bar chart, we are going to compare the male and female participants based on gender, that is distribution of students based on gender. That is, we are comparing the male and female participants. That is, this becomes a multiple bar chart. Then we have a component bar chart. Same table can be represented, same diagram can be represented as a components, as two different components. That is, you have to compare the distribution of students by gender, that is male and female. In each year, how many male and female are there? That becomes a component bar chart. So, you have two components in it. That is why it is known as a component bar chart. Then you have pie diagrams, mainly used for comparison based on the color. So, you have in a pie diagram, you have different colors, mainly for better representation of data, better understanding. So, this is an example of a pie diagram. Under graphical representation of data, you have a histogram and frequency polygon. So, what is a histogram? Histogram is nothing but we give a this is a histogram, that is histogram is nothing but distribution of patients according to the age group. So, when we plot the distribution of participants according to the age group, we get a diagram like this, that becomes a histogram. In the same histogram, when the midpoint of histogram is connected, that becomes a frequency polygon. So, frequency polygon is nothing but when the midpoint of the histogram is connected, that becomes a frequency polygon. This is a example of line diagram. So, again we plot the histogram, we connect the midpoints and then we draw a line. So, that becomes a line diagram. So, it is a line diagram, is again a graphical representation of data. Then we have pictograms. So, what are these pictograms? Pictogram is nothing but pictorial representation of data. Pictorial representation of data, by example population per physician. So, that means it is we are describing the results in a pictorial representation, that is why it is known as a pictograms. Okay. Till now we saw about what is a graphical representation of data, a tabular representation of data, and also as charts. So, this research methodology topic is very important. The basic research methodology, you have to know about what are the different types of data, primary, secondary, then you have a qualitative, quantitative data. Sampling procedure is very important for data collection. Then after the data collection is completed, the results has to be presented in a more logical manner. So, that is why this presentation of data is most important. I would like to conclude by saying that conclusion of a research paper often reinstates the research problem, summarizes the arguments and discusses the implications of the study. So, research methodology often ensures the reliability, validity and generalizability of the research findings. So, every step should be taken in order to achieve a good study or a good research outcome. So, it often not only helps the researchers gather the data efficiently, but also help them to make more logical conclusions through qualitative and quantitative research outcomes. Thank you all for watching this class.